Hi, I'm Kate Remfrey,
I'm Kaylee Batanti.
And I'm Liz Dustin.
and we're here to tell you more about how to handle your recent diagnosis of type 1 diabetes. First, I just want to say, don't worry, you are not alone.
Over 3 million Americans have type 1 diabetes, 15% being children. If you are an adult and you are part of the 5% of the population diagnosed in adulthood.
As long as you make the suggested changes to your lifestyle, you will live just as long as your non-diabetic peers.
In this video, we will cover the biological workings of type 1 diabetes, dietary recommendations, blood sugar monitoring, lifestyle changes, and people who will help you along the way, as well as other things to be aware of. What happens with type 1 diabetes is your body essentially does not produce insulin, the hormone needed to let the glucose in a cell in from the bloodstream. This allows the glucose to build up in the blood, leaving the cells deprived of energy. The absence of insulin can be due to autoimmune factors or disease of the pancreas. In order to manage type 1 diabetes, insulin injections are used to regulate blood sugar, which we will discuss later.
Now that you understand what type 1 diabetes is, let us talk about how to handle it. As a diabetic, you need to monitor your diet closely. Meals should be eaten at the same time every day along with snacks. Do not skip meals or snacks. It will disrupt your insulin schedule. The recommended diet for a diabetic is as follows. Grains, beans, and starchy vegetables, 6 servings a day. 3 to 5 servings of dark green and yellow vegetables per day. 2 to 4 servings of whole fruits, especially citrus. 2 to 3 servings of milk per day. Be sure to use low-fat milk or yogurt. 2 to 3 servings of fish or poultry per day. And also limit fats, alcohols, and sweets because of their high carb content. Limit carb content because they are high in glucose content and require more insulin to break down. Avoid foods that spike blood sugar.
Speaking of blood sugar, now we can discuss blood sugar monitoring. Monitoring gives people the ability to understand if the amount of insulin they are using is appropriate. People with type 1 should check their blood sugar 6 or 7 times a day, with a maximum of 4 times a day, including in the morning and before each meal. Check by pricking your finger with the lancing device to draw blood. Then place the test strip to the blood and the machine will register your blood sugar. An ideal level is between 80 and 130. If it's too low, adjust the amount of insulin you use or eat a higher carb diet. The opposite applies for high blood sugar. In addition to dietary changes, lifestyle changes like exercise can be incorporated. Exercise can prevent heart disease and help lower blood sugar naturally. Visiting the doctor's office frequently helps to catch cholesterol, blood pressure, foot and eye disorders. Managing stress can also prevent high blood sugar. Deep breathing, yoga, and hobbies that relax you are great ways to de-stress. Decreasing smoking and the use of alcohol can help lower blood sugar and other complications, such as kidney disease, blood vessel disease, and nerve damage. As a whole, living a healthy lifestyle is important for diabetics.
Along the road of diabetes, you will need the help of many medical professionals along the way. Primary care physicians can watch out for warning signs of complication from diabetes, such as damage to extremities and ocular damage. Nutritionists can help create a meal plan to follow and regulate blood sugar. Nutritionists can also make sure you're getting enough nutrients without creating a buildup of sugar outside your cells in your bloodstream. An endocrinologist can also help you make sure all your other glands are working, except for your pancreas, of course. They can also check for cancer in your pancreas and other glandular issues that will influence your diabetes. As a whole, diabetes can be a daunting diagnosis, but with the proper help from medical professionals, lifestyle changes, meal plans, blood pressure monitoring, and exercise, you can have a successful life even with diabetes. There's support networks out there for people who are still feeling a little anxious about the whole journey. When in doubt, reach out for help, and there are plenty of people to assist you on your journey through the diabetic world. Thank you so much for watching this video. If you have any questions, please contact Kaylee, Liz, or myself.